Hello, I'm Suresh Gunasekaran, CEO of University of Iowa Hospitals and Clinics and Associate Vice President for UI Healthcare. We are delighted to again be part of the Iowa Ideas Conference. Now in its fourth year, Iowa Ideas provides a unique opportunity to bring together a wide variety of different voices, perspectives, and thoughts to create a better future for us all. 2020 is a year that none of us could have predicted and has given us unprecedented healthcare challenges. In some ways, these challenges have made us better at delivering care, but it has also further highlighted the serious gaps some Iowans face in receiving adequate healthcare services. Let's start the discussions here and follow through to deliver better health for all. Thank you for being a part of this important discussion.
Good morning, everyone. We're about to get started here. Welcome to Strengthening Rural EMS Services. My name is Kat Russell. I am the room host. Comments and questions are welcome. If you're going to be tweeting or using social media, remember to use hashtag Iowa Ideas 2020 to share your big takeaways or thoughts on the conference. I'm going to pass it on to our moderator now, Michaela Ramm.
All right, thank you, Kat. Hi, everyone. My name is Michaela Ramm. I'm the healthcare reporter for the Gazette, and I welcome you all to the 2020 Iowa Ideas Conference. So glad that you could join us. I know this year is a little bit different than the years in the past, so I appreciate you trying this out with us. So to kick off the healthcare track of this conference, we will be talking about strengthening rural EMS services. Now, because EMS is not considered an essential service here in Iowa, agencies in rural Iowa often face major challenges when it comes to providing their emergency medical services to Iowans. Iowa isn't the only state alone in this particular issue, but when it comes to Iowa, based agencies, they face a number of factors because of this. They often have to travel further than their urban counterparts, but at the same time receive lower reimbursement for that. Many agencies rely on volunteer manpower, which makes it difficult to recruit and retain well-trained professionals in this field. Now, before I get too into it, we'll talk about all of this and more, but first I'd like the panelists to introduce themselves and kind of talk a little bit about their experience in this particular issue. So Jack, why don't you start us off?
Sure. My name is Jack Seward Jr., and I live in Westchester, Iowa, which is in Washington County. For the last 8 years, I've been serving on the Washington County Board of Supervisors, and before that, I retired after 30 years in law enforcement. I've served in capacities with volunteer fire departments. I was an EMT back in the 70s and the 80s. So that's what's gotten me into this situation here was the ambulance service in Washington County. The owner of the service was going to retire and he didn't have a buyer for his service. So we were looking at a lot of different things, and within the last year we hit upon a solution for us. So I'm here, I think, just to talk about that a little bit.
Yeah, and we look forward to you talking about that. Andi, do you mind introducing yourself to us?
Yeah, I'm Andi Deering. I live in Folesville, Iowa, which is in Allamakee County in the northeast corner of Iowa. I have been on the ambulance service in our community for roughly 4 years. I was a driver a little bit before that, which sparked my interest in becoming an EMT and being able to do more for my community and people. So I guess that's kind of what I have the inside knowledge of actively being part of the EMS and what we see on a daily basis as far as the struggles and and for me the benefit of doing it. So a lot of people don't think of that. They think of everything they sacrifice, but I see a lot of the good. So that's what I enjoy the most.
Yeah, absolutely. And what a great perspective to have on this panel. So I appreciate you both joining us. Now, to kick it off, let's talk about this particular issue. You know, when it comes to the fact that rural EMS agencies really face a lot of challenges here in Iowa. To start us off, you know, how did we get here? How did we get to this point where emergency medical services in Iowa really kind of face a lot of these barriers? I'll leave it open to both of the panelists.
I guess I'll say that traditionally ambulance services were centered in the urban areas or in the cities. And so they were either run out of a hospital, run out of a fire department, or they were just a locally contracted service. It's a little different in the rural areas, and in the last couple decades or whatever, we've developed a quick responder service. So the rural areas treat it differently, and we have found different solutions to that problem. Washington County, we started an ambulance service. I won't say we, but an ambulance service was started back in, I think it was 1972. So that's about almost 50 years ago. And it was a private service, but it was subsidized through an agreement that specified some basic requirements that we're going to follow. It's grown into that ambulance service supporting 7 quick responder or first responder services throughout the county for training, policy, and protocols. So that's what we have grown into. It's something that's developed over that, like I would say, almost 50 years. And the County Board of Supervisors for the last number of years has subsidized that service at a rate of about 38 cents per thousand of taxable value. That provided about $450,000 a year in subsidies to that service. We need a replacement because the owner of that service for the last 32 years, I believe it was going to retire. And we needed to figure out a replacement for that service.
Yeah, absolutely. Well, while we're speaking on what Washington County has really done when it comes to this particular issue, Jack, I hope you could talk a little bit more about what led the county to decide to take this on. Is this the most viable option when it comes to EMS services that are struggling financially in rural areas, or is Washington County really unique in kind of taking this on as a county-owned service?
Well, I think we're fairly unique in how we've approached it, but what we did a year or so ago was to get a group, an advisory committee, if you will, together to talk about the different options that we had. We took some ideas from the Farm Bureau about funding. We also took we examined some of the available options in the state law, which involved, let's see, Chapter 422D, which allowed for a vote of the people every 5 years to levy a tax. Chapter 357, there were several provisions in there that dealt with different things, but in essence, what the Ambulance Advisory Committee came up with was the first option, because EMS is not an essential service. It's not required like law enforcement and fire service. And that means really that a city or a county does not have to provide for ambulance services. So the first option was we could withdraw from subsidizing it, just anything to do with it, and save the taxpayers $450,000 a year. We didn't think that was a good option, so we went on to continue to look at the other options, which included offering an RFP or try to find a private business to take it over, assist in the formation of a not-for-profit entity to take over the service, to approach the hospital to see if the hospital would own it and operate it out of their service. And the fifth option was the county-owned option, and that's ultimately the one that we thought made the most sense for us. It's not going to make the most sense for every other county around. But for us, it did. So that's where we went.
Yeah, absolutely. Yeah, could you speak more on why this may or may not be a viable option for every county in Iowa? It sounds like from what you're saying that Washington was sort of unique in taking this particular approach. But could this be a solution?
Well, we learned a little bit from Wright County, Iowa. A few years ago, Wright County went down the path of the 422D and took it to a vote of the people as to whether they wanted to raise taxes to support ambulance services in their county. The difference is in their county, they had, I think, 5 different ambulance services that serviced a different part of that county. So they raised taxes, it's my understanding, they raised taxes on the county level and then apportioned it out to those other services to subsidize them. Washington County only has 1 ambulance service in the county. So we weren't faced with that kind of a situation. And as far as some of the other options, it just didn't seem to be a good fit for our county. In other words, one of the options was county supervisors taking over the role of, or assuming the duties of the township trustees to raise money and taxes. It just wasn't going to work. And at this point, I guess I have to say that EMS services in the state have been asking the state legislature since the 80s to make it an essential service so that it could be a line item on your taxes. But there's been a lot of resistance to that just because nobody wants to see your taxes raised. On the other hand, there are things that taxing is appropriate. And we've always felt that emergency medical services is appropriate and we should be supported by a tax base.
Yeah, absolutely. Well, now before we get too deep into that particular policy discussion, I wanted to take a moment and switch to Andi and his perspective when it comes to being a local EMT. So Andi, could you talk about that recruiting and retention piece for us? Why recruiting EMTs has been a challenge? Because it's my understanding a lot of these agencies rely on volunteer EMTs, correct?
Yes. Yep, they do. The biggest part is I believe that a lot of the younger people in the communities right now are just they don't know a lot about EMS, I guess, and the stuff that you provide while doing it. It's something that I didn't really even give a thought about when I was in high school or in college or anything like that. It wasn't something that I even really thought about. I didn't have any interest in the medical field at all. Until one time that I just seen the ambulance one time and I'm like, you know what, I'm going to just call them, see what it's all about. And then they asked if I wanted to start driving. So that's what I started doing is driving the ambulance and, helping load the patients and all that. And then after that, when you're sitting there driving the ambulance, you're hearing everything that's going on in the back. You're hearing people asking questions, and it just sparked my interest of, I really didn't know much about any of that. And it's probably something a person should know more about to prepare themselves for if they ever get into a predicament themselves. A lot of people, don't like the commitment of the pager goes off. You never know when it's going to go off. You could be at a family event. You could be at for a holiday with your own family, and you could be wanting to go golfing. So it interrupts your life, quite a bit in that perspective. And a lot of people don't want to commit to that. But that's the one thing about smaller communities, smaller rural services is the people that could be on the other end of that call, and you would want them to you would want us to show up. I would want them to show up if something would happen in that case. The other side of it is schooling. It costs money. Luckily, our service is fortunate enough to help pay for the schooling to try to get people to commit and be a part of it. An EMT class is roughly around 132 hours of education. You have your clinical time on top of that. So it takes quite a bit of your time. Classes from 6 to 10 at night, which is fortunate for the working people that you gotta make time to do it, and that's when it would work. So that's what allowed me to do it, because otherwise I would not be able to do it. Not only then once you do get the class and you pass, you got to continue that education. You got to have it used to be 24 hours continuing ed every 2 years, which now it just changed actually just recently to 20. That's just EMT. Then you get to the more advanced, paramedic. Their classroom hours is roughly 1,000 hours, give or take. So that's a huge commitment. That's also a night class. That's 3 times a week you're meeting, driving to class, and then that's not study time on top of it. So they also have 60 hours of continuing ed that they have to have every 2 years. That's a huge thing. That's a huge commitment to try to stay on top of it and stay certified. That's for national stuff. So, as far as, statewide, that's a little different. But initially you have to get your national to obtain your license. The other thing, for people is, they fear going back to school. They might have been out for, a few years, 10, 15 years, and they're like, there's no way I'm going back to school. To do that, that's a lot of people that don't want to make the commitment to do it, and honestly, for me, it went really fast, but I enjoyed learning everything about it. So that's something that's, the commitment for people, and, a lot of people are scared of, sometimes you don't see the best things. And obviously those are the pictures you can never get out of your mind, but it's also you're knowing that you're doing something as good as you can for your community, and I think it's a great way to give back.
Yeah, absolutely. All wonderful points. And kind of to that last point you brought up, I wonder, with all the time commitment that is involved, and like you said, it is a very hard job, and you get some very tough calls some days. Is burnout a pretty big concern with this particular career?
I think that's the other big part is, there's so few of us now that those ones that are on the service and actively are going on pretty much every call, because, they don't want to hear that page go off 2-3 times and they page a different service to fill in for you. I could be really busy, and if I hear that, it hits big time to me. So I think that's a big part of people who get, burnout fairly quick, is because they get a couple calls in a week, and some of them are, in the middle of the night at 3 a.m. or 2 a.m. And then all of a sudden you got to get up at your normal time and go to work. And, it takes a toll on everybody. And that's not reports and all that stuff that you have to do. And the risk you run with being exposed to some of the stuff you'll see. So it's a huge thing, is it's the number of people have really limited and really pushed and put a lot of pressure on the ones that are still actively going.
Yeah, absolutely. And it kind of goes to the point that you had talked about earlier in one of our earlier conversations before the panel, just there are other career options that may be more appealing to this particular population. If you have this skill, maybe you could get a job elsewhere, maybe not necessarily outside of rural Iowa, but it seems like that could play a big factor as well.
Yeah. Oh, go ahead, Jack.
I'm just going to say, I want to jump in and give you a hat tip, Andi. You and the other younger folks that are getting into this business these days, like you said, there's a lot of commitment just to the schooling. But the other thing is, it's taking time away from your family too. We understand the push and the pull of those different areas. A lot of the folks in EMS and the local QRS, and I'm focusing now on my comments in the rural area. because it's a rural area where you have a lot of volunteers. There's a lot of distance between the services that are offered. A lot of the rural volunteers are in their 50s, 60s, 70s. And if we don't get the younger folks into the business to replace the older ones as they retire out, we're going to have a significant lack of personnel to cover these things. We notice it more in the rural areas than you do in the cities. Just the way it is. I'm sorry. We would appreciate some more help in training. It used to be there was a state grant to the counties for EMS services, and it used to be, if I remember right, around $10,000 or $11,000 that could be used for EMS training. And now I think that grant is down to around $3,000, and I'm using Washington County numbers now. But there's so many strings attached to that. Some of those strings come from the schooling. For instance, it used to be we could offer a 4 or 5 student class for an EMT. But Kirkwood Community College, they are the ones that have to certify the training. And they're now, I think, requiring a 12 student class in order to even start one. I have heard that there are instructors that would give up their instructor fees to teach a smaller class, but Kirkwood won't allow it. There's also some limitations on what can be done according to the Chapter 132 of the Iowa Administrative Code that governs a lot of what goes on in EMS. And that's going to have an impact very soon on quick responder services in the rural areas. One of the big things that's going to impact is the requirement that a quick responder service can't be certified anymore unless they have 100 calls a year. We have, I think, 7 quick responder services in Washington County. And if that is a hard and fast rule, then we're going to have to figure out how to go without 3 or 4 of the QRS teams that are now operating. So there's a lot of impacts coming on. There's a lot of things that the legislature could do, and we've tried to do some of those things, but those efforts have failed, and I can suspect as to why they failed, but I would rather have had our legislative rep here to maybe answer some of those questions too.
Yeah, absolutely. So I wonder too how much the fact that Iowa's an aging population plays into all of these larger issues too. Does that mean EMTs in rural parts of the state just have more work to do? I know you mentioned that is becoming a challenge in terms of the workforce. You know, we have these older EMTs and paramedics who are retiring. We don't quite have the younger population coming into this field to replace them, but how about in terms of just the work the remaining EMTs have to do? You know, a lot of our older population in Iowa lives in rural Iowa. How does that kind of play into this particular issue?
Well, I can maybe try to answer that to begin with. When you look at a smaller rural area, you only have a limited amount of people and a limited amount of ambulance rigs. With an aging population, there are more transfers between nursing facilities and hospitals. And so when you are using resources to do that, yes, that's a good thing, but it's also limiting what you have available when that 911 call comes in that you need an ambulance for an accident situation. They're just, it's the tax, not the tax. It's the requirement for sustaining everything that needs to be done, that you may not have an ambulance right there ready to go for an emergency situation when they're being asked to do more of the transfer type situations. Is that what you are seeing up in Postville, Andi?
Yeah, and I was just going to put on that point is, yeah, we have a fairly good sized nursing home. Not saying that their stuff is any, less important, and I don't think you said it that way at all, because they're important. They need to get transported to, their facility. But like you said, it's taking that resource. It's not only the resource, because we are fortunate enough to have 2 ambulances, which is good, because there's a lot of times we do utilize them, but it's the people that you're putting in that rig that you don't always have to fill that second rig. So that's the thing is, a lot of times if we go on a call, if three people show up, there might be one guy that just says, if you don't need any help, I'm just going to back out and I'm going to stay here. Because if there's another call, we don't always have enough people to fill that rig. So that's one person they wouldn't have to worry about. So then we don't, maybe only, as long as it was an EMT, then we need, just a page for a driver. Instead of getting the medical person, you have one of those. So you can kind of fill in. We have, kind of sub drivers that come in quite a bit that are, if we need a driver, they can come in. They're on our service to drive. So they don't do it very often, but they're there for those holes that we need filled in a time like that. And like you said, it actually happens more times than not that you're out on a call and another one comes in, and either you're not back yet or you're the other end of the county, and you have to either try to get back, and depending on the call, you don't have time. So that is a good point, that it's not always just the resources, it's the resources of the people that are a key that you have a hard time finding.
Yeah, absolutely. Because that's very interesting perspective in all of this too. It's not just the resource and the manpower, but time is also a very big element here. I mean, if you don't get to a call in time, that could really impact somebody. I guess, I've been kind of thinking about this question as we've been talking about this, but I'm curious, panelists, if there is a concern statewide that there are parts of Iowa that just don't have enough EMTs, that don't have enough manpower to get from one county to the other, and if we really are starting to see that now. I guess I want to get your thoughts on that, if that is a major concern at this point.
That's a hard question to forecast. Each individual jurisdiction, I think, has their own experience in that area. So it's hard. To me, it's hard to try to come up with a solution that's going to work statewide. What works in Johnson County, which is just our next door neighbor to the north, doesn't work down here in Washington County very well.
Yeah, good point.
It's a different geography. It's a different population base. Washington County has a population of 22,000 people, roughly. But we're spread out in 7 communities all over the county. So we're pretty spread out. We're not living one on top of another. It's hard to centralize things. Where if you have other counties, I'm going to have to plead ignorance on the Postville situation, because I don't know if they've got just one big city there or not. But it's just different everywhere you go. It's like before when I talked about what Wright County did. I think they were the first county in the state that took advantage of Chapter 422 that allowed a vote to raise money, to raise taxes. But that vote had to happen every 5 years. If we made a change to that law so that it wasn't in question every 5 years as to whether you were going to be able to sustain a service, because the population might get mad at a certain politician and not pass that vote the next time. Those are the kinds of things that we need to change, so that there is a flexibility for the local officials, whether it's city or county, to be able to design a system that's going to work for their particular locality. What works for us down here isn't going to work for Andi and the fellows up in Postville.
Yeah, that's an excellent point. Yeah, Andi, do you have any thoughts to add to that at all?
I would just, we're a small town. But like I said, the other day when we were talking, that we're fortunate enough to be, in the corner of, we're right between, 4 counties. And we're fortunate enough to have 18 miles away is a hospital, and 18 miles the other direction is another hospital. And same, we have 3 different ones that we can go to. And so our patient, in about 10 minutes, you can be to the hospital. On the other side of that is we have, a helicopter that's at one of those hospitals or in that town. Gunderson Air is in there, and we're fortunate enough to have a helicopter that can be there and on the scene within 7 minutes. So that's pretty fortunate in our case. We also have, those hospitals have their own services. So we can tier if we don't have a medic on staff, we can tier and get the best possible care relatively quick. So that's one fortunate thing for us. But I know even on their side, they have a hard time, filling, their positions. It's just a different job for a lot of them. A lot of them start there and then they end up going to the more local, in the hospital setting where everything's a little more controlled. Not everybody does that. I'm not saying that's for everybody, but that's a lot of people go that way, and it has to do a lot with the time and also the pay that those paid services get. They have a hard time keeping those people in that specific category of medic, EMT, because of the time, the settings, and the wages for those paid people. So
yeah, absolutely. Wonderful. Well, obviously, I kind of have to ask the question about the elephant in the room. We're in the midst of an ongoing pandemic. Curious if the pandemic has really exacerbated any of these issues or any of these conversations you guys are having about struggling EMS services. I see you guys are kind of smiling, so I'm assuming you guys have a response to that.
Go ahead, Andi.
And that's a whole nother ball game that really kind of hurt our service as a whole, because we did have the elderly ones that we did have on the service still helping. Obviously they're not as active, but there are also people that could fill those voids of, when I'm going to say us younger ones, and our family did have a family thing and we were out of town or gone, they would fill those little gaps that, now I don't really blame them if they're at that category where they want to stay, protected and don't want to risk themselves, because obviously we have seen a spike in transports of people with that, with COVID-19. Obviously we do the best we can, and to protect ourselves, which we always do. That's what they, pound into your head when they're in school is, it's you're number one. You can't help anybody if you're hurt yourself. So, that's a big part of filling the gaps with those people that, they don't respond near as much or at all anymore. And I don't, I don't blame them. But it's also hard to recruit people to want to be an EMT or more right now because of all this. It's not only because of the, COVID-19 and the risk of contracting it or anything like that or bringing it back. I think it's more so the schooling is pretty tough, because for us to, a lot of us, it's a lot of hands-on stuff. There gets to a certain point when you have to do the hands-on work, learning. So you have to basically go all into this, and you have to be into it. You can't do clinicals behind a computer screen. You need the hands-on skill sets that are probably one of the most critical parts of it, because there's a lot of people that know a lot of stuff about it, but it's the hands-on, and it works in conjunction to what you know. So I think the recruiting people right now it's hard because of that. A lot of people are concerned about whether schooling be harder because you're not in person. I can't speak for myself, because luckily I was in and out of it before this came along, because I don't know what I would have done, because I'm a hands-on person. That's my input to what COVID has done for the recruitment, and also the people that don't respond as much anymore because of it and their age. So
yeah, absolutely. Jack, do you have any thoughts maybe from the operations standpoint of how the pandemic has impacted things?
Well, I'm not the expert on this, so I'm going to go by memory off of what I have heard in the past few months. Initially, I will say that I don't believe that our EMS services in Washington County was greatly impacted with either employees contracting it or being quarantined because of a contact. So I thought we came through that pretty well. The second thing is, from a business standpoint, if you're not making runs and making money off of those runs, it sounds like a bad thing to say, you're making money off of ambulance runs, but that's the thing. It costs to keep 3 or 4 ambulances, to keep 2 fully staffed, so that you've got a lot of overhead there. And if you're making runs and if you're receiving revenues from those runs, that's a good thing. Initially, because of the lockdown, because the hospitals weren't doing routine surgeries, they weren't doing routine things, and because people were traveling a whole lot less, the business in the ambulance service, the number of calls, the number of transfers went way down. People weren't going anywhere, they weren't traveling, so they weren't getting in accidents. That's a good thing. But it just saw the numbers drop. Now, since things have opened up a little more, things are getting a little more back to normal now that the hospitals are doing routine surgeries and things like that more often, and people aren't afraid to get out and go places, then it's returning to somewhat of a normal situation. But it did take a little bit of time for us to get caught up on the personal protective equipment, things like that. Hat tip to the local emergency managers, who were just a huge part of making sure that we had what we needed to continue to do the job. So that's a hat tip to the emergency managers. But basically, I don't know of anybody that can argue with a straight face that emergency medical services is not essential to anyone in the state of Iowa today. So why they are resistant to making it an essential service and to allow a dedicated tax base to support it. I just don't know where that argument is and why it's not done. I know that last year there was a bill that was passed. I think it was House File 2434 that was passed in the House. Even the Farm Bureau supported that one, but it was killed in the Senate. We need to ask some questions about why. It's something that we need, and I haven't heard any good reasons why we haven't provided for that yet. But we need to have some flexibility. We need to have some money for training, and that's what the state can do for us, is to give us a little more flexibility and to tailor the things that we need to supply us with what we have to have.
Yeah, definitely. Yeah, and I appreciate you bringing that back up, Jack, just because the whole purpose of the panel and everything really kind of comes back to that point that EMS is really not considered an essential service. So I guess could you kind of speak on, I don't know if you have any insight on why this has not been considered essential service, even though there have been efforts, you said, since the 80s to make it so. I guess, do you have perspective on, it seems like it kind of comes down to taxes, but is that accurate to say?
I think in a broad way, yes. And it is a political deal. We've seen in the past where a political solution is found and it can be done. And this is one of those places where, yeah, nobody likes to see their taxes go up, but there's a proper time and a proper place for taxation. I don't care whether you're Democrat or Republican. Taxes are a fact of life, and what those taxes go for makes all the difference. And if it's something like this, like emergency medical services to respond to 911 calls, like I said before, I don't know of anybody that can argue with a straight face that is not essential. So why it isn't treated that way and why we're not allowed to make that a part of our budget every year, I just don't know.
Yeah, absolutely. Could you talk about some of the lobbying efforts that have come up over the past few years around this issue? Could you kind of speak on what people have advocated for around rural EMS services?
Well, I know that Richard Young, who's also on our board of supervisors and been involved in ambulance services for 30 plus years, he's told me personally that he's lobbied at the state level almost every year since the mid 80s to improve things. It just, for some reason or other, hasn't been so successful. This year, and I'm going to read right out of the policy statements of the Iowa State Association of Counties, that ISAC supports authorization for property tax like the township property tax for fire service. EMS should be considered an essential service and a dedicated funding mechanism should be authorized. Local, state, and federal governments must strive to provide training and incentives for assorted emergency and public safety personnel in underserved areas. That's common sense. And so we're lobbying for that. We're also lobbying to make these rules and regulations and the guidelines that I talked about like I talked about before in the Iowa Administrative Code, Chapter 132. What works in Des Moines doesn't work in rural Washington County. So you can't make a single rule that applies everywhere because everywhere isn't like anywhere else. And this is one of the examples that just goes to show that you can't make a single rule that works everywhere. It works good some places. It doesn't work very well in others. So you have to allow us some flexibility to make our own decisions at the ground level.
Yeah, absolutely. And kind of a question for both of the panelists. I'm curious then, do you think the solutions to addressing these challenges that rural EMS services face in Iowa, does this have to be a policy decision then? Or are there other solutions that exist out there that maybe individual counties or individual agencies can kind of take on?
Andi, do you have a thought there?
I don't. I don't really one way or the other. I agree with, what you said about, basically the big thing would be making it an essential service. That would drastically help, every service with, pretty much everything that they're doing right now with, thankfully for local donations of people and memorials that go to the services that allow us to get gear, update our ambulances because, the medical field is obviously always changing. Stuff gets outdated. You know, a new ambulance is an expensive thing. So when you think of a small town that does have two of them, you know, that's a huge thing that, you know, a lot of people don't even think about. You know, it's not only the people running them, but and the training that you have to do that. That's one thing for us. I do know is, you know, it's a volunteer service, but they basically they try to, as much as they can for some of our trainings, to kind of keep us going and so that we're not sacrificing basically everything for that. So that's, you know, luckily we have some very, very big memorials that come in, you know, families that have had a lot to do with the town, the community, and the service, that donate, you know, a lot of money and continue to donate money for those things. Because without them, you know, it's all coming off of the revenue that we can get on calls, you know, and then, you know, that goes to a lot of the calls that are, you know, no transports or stuff like that, where you're still using the resources, you're still using, you know, basically everything, but that's not something that you're going to ever see any revenue off of. So it's a tough thing to really, you know, pinpoint down, other than, you know, there has to be some other avenue other than stressing our communities with hoping for donations and stuff like that.
You mentioned a little bit about increased costs. We talked about that locally the other day, and an example was given that in about 1985, an ambulance, just plain rig, cost about $20,000. Today, if you're going to buy a modular ambulance, that cost is about $300,000. You can't just put that on the backs of pancake breakfast and stuff like that. But you also have to remember too that the operating costs are affected by reimbursement rates, which for Medicaid have been stuck at the 1985 level. Trying to think when the last time there was a rate increase, but it really hasn't kept up with the way things are going. So I guess bottom line in your question is that the state and the feds need to provide what they can to support us at the local level. Whether you're elected to a city council or elected to a local board of supervisors, you're the ones that are going to answer to the people and to find an answer to provide this essential service. Now, whether that's going to be to contract out to an existing private ambulance service or whether to create one of your own, that's up to you at the local level. And that's where those decisions and that's where that power needs to reside. We just need the help from above to, number one, don't make things any harder than they need to be. And number two, to give us the support that we need.
Yeah, absolutely. Well, great. Well, now we are about 7 minutes left in the panel, and I wanted to take a moment to be sure to generate some audience questions. Now, I see one kind of populating the chat right now, but to other attendees listening in, please, if you have what questions you have, send them over in the Whova, and we will get them answered for you here in a moment. Now, the first question from our audience came from Peggy with NAMI. She asked, do you deal with mental health crises a lot? And if so, do you receive any training on dealing with these particular mental health crises?
Andi?
Is she asking for patient-wise, or is it the mental strain of, you know, the calls and the stuff that the EMTs and paramedics see? You know, as far as mental cases, as far as, you know, patients, I would say we see it some, and yes, we do have training on it, how to handle situations like that. You know, it's a very big topic, I guess you could say, because there's so many different avenues that you will see or could possibly see. You can't pinpoint, one thing, somebody's mental issue may be something completely, irrelevant to the call itself. But yet also you have to be able to manage them until they get to higher care, I guess. And if she meant as far as EMTs and keeping them around because of stuff they see and stuff, it's a real thing. There's a lot of things that like I said, you'll never forget. But there's help. There's training, there's debriefings, there's a lot of avenues to take. As far as that goes, there's a lot of people that donate and give up their time to come and do debriefings. They're trained people just to sit with the group, whoever was part of the call, and go over stuff. As far as doing that for the public, I'm not sure on the help that they could possibly get. I'm sure that those people would help because that's a big part too. Witnesses to something, they have to deal with some of the same stuff that we do. So I guess I don't know if her question was directed one way or the other, but I would say that we do see some cases, yes.
Yeah, it looks like in the chat, Peggy clarified that she was asking about patients, so calls for patients. I wonder, are you guys seeing maybe more these kind of calls come in through? And maybe somebody who has had a longer career may have a different answer than you, Andi, but I'm curious, are you seeing more of this? Is this becoming more of a trend?
I would say that, the one thing about local and small communities is these people are not calling their services to get the help they probably could get. That's the one thing is that they're going, because everybody. So they're going a different avenue. They're probably, and if they're not, that's what they needs to be taught to them. There's other avenues without, staying anonymous and so that nobody else really knows, because a lot of people don't want to come out about it. But it's something that there is. Obviously with COVID and everybody's cooped up, there's a lot of people that are struggling with a lot of issues that now have been pushed past that comfort zone that they were controlling it at. So that's one thing that I could see, some changes coming up with it. So. Yeah,
absolutely. Jack, do you have any perspective on this as far as what Washington County agencies have seen among this trend?
Not as it refers to or relates to emergency medical services and ambulance transports. I also happen to serve on the Southeast Iowa Link or the SEAL region of Mental Health and Disability Services. I'm on that board. And we've developed a critical incident teams that respond to mental health crisis or emergencies. And we try to de-escalate, we try to provide the training to law enforcement to be able to de-escalate those things and handle them in a way that they don't have to take them to jail, basically. So there's not a lot of transport that is required by our emergency medical services. We find alternate ways of dealing with those kinds of things, but we're active, not in the ambulance business of transporting people with mental health needs, but we will when it's necessary and appropriate.
Okay, absolutely. Well, unfortunately, it looks like we are all out of time. But I do encourage the attendees today, if you do have any other follow-up questions for our speakers or want to continue this conversation, please utilize the Whova app or Whova on desktop. There's options to direct message our panelists here, Jack and Andi, or you can talk to each other in the session chat box. I encourage you to utilize that feature. Now we will wrap things up, and just let you know that the next session that is on for the healthcare track is rural healthcare issues. I know we kind of touched on this, but hopefully this panel will touch on it more broadly about what healthcare in rural Iowa looks like and what challenges are, are met once you do get out of the ambulance and into your doctor's office or into the hospital. So I encourage you to please attend that. And I thank you all for joining us today. And thank you for Andi and Jack for sharing their great insight with us.
It was our pleasure. Thanks.
All right. Thank you, everyone.